Well, welcome everybody. My name is Anna Von Trail, and I am with the Health Sector Partnership on the Behavioral Health Committee. And I work at Common Health Systems. So welcome, glad you're all here, and hope you're enjoying this conference and getting a lot of good information, a lot of good insights. So our next session is, how do you get that experience while you're in undergraduate school? So we have Emily Berg, and Emily is a proud alumnus of Colorado State University, where she obtained her bachelor's degree and master's degree in human development and family studies. Emily is a licensed marriage and family therapist and licensed addiction counselor who has primarily specialized in treating trauma and addiction. Over the course of her career, Emily has worked in various treatment settings, including community-based services, university counseling, private practice, inpatient and outpatient settings, where she provided both direct services and clinical supervision. As the clinical scholarship supervisor, she oversees the internship and scholarship programs at SummitStone Health Partners. Emily has a passion for supporting students in their professional development while creating more equitable and inclusive learning opportunities for students with a focus on system improvement and providing compassionate leadership. In her free time, she enjoys spending time with her partner and 3 children, running, reading, puzzles, and building Legos. How fun is that? All right, Adriann LaRue is a social work care manager at Village Medical, where she works with patients across the lifespan. At Village, she is on the Health and Workplace Equity Committee, a DEIJ initiative. She previously worked in the juvenile court system in Utah and as a small business partnership coordinator for CSU. She completed her MSW in 2021 and is working toward clinical licensure. She recently completed a peer support training program for first responders. Adriann, volunteers with Diamond Peak Ski Patrol, spends free time with her spouse chasing her toddler and 12-year-old pup. So welcome. I'm going to hit that door really quick so that we don't get outside noise. But go ahead.
Great.
Slides are ready.
All right. Good morning, everyone. Thank you for having us. Oh, Anna, is it okay if I just move
The arrows?
Okay. All right. Just wanted to make sure. Yep. So I'm Emily, been at SummitStone Health Partners for the last 6 years, and my job is I get to supervise our programs for interns and scholarship participants. So I'm going to tell you today about some opportunities that we have at SummitStone for undergrad internships. So it looks like the arrows are
There we go. Oh, was it maybe it's just right now.
Okay. Great. So a little bit about SummitStone. SummitStone is a community mental health center. We've been serving Larimer County for the last 65 years. Truly, if there is a need in Larimer County for behavioral health services, whether it's substance use disorder, mental health services, we likely fill that need. So our services are organized into 4 primary clinical divisions, which includes outpatient services. We have acute services, which includes our crisis stabilization unit, walk-in behavioral health, urgent care, Garcia House. We've also got community-based services where instead of clients coming to us in an office setting, we meet clients in the community truly wherever they are at. So it might be in their homes, somewhere else where they're receiving services, or wherever they might be staying. And then our last division for services is our forensic services. So working with folks involved with criminal justice system and really tailoring those services to those folks because they have different needs than clients that we might see in different settings. So some exciting new developments that we have coming up. You might have heard about our Longview facility, which we are partnering with UC Health and also the county, which will have 6 different levels of care there. So very exciting. It's filling a huge need in our community. And so that will be opening later this year. And so we will have a number of internship opportunities there as well. But yeah, pretty exciting, more to come. And also with that facility, we're going to be hiring around 150 folks to staff that facility. So lots of opportunity coming available for interns and folks looking for employment. Okay, so some benefits to interning at SummitStone include frequent and direct supervision from licensed professionals. So being supervised either by myself or I've got a team lead. My background, I'm a licensed marriage and family therapist and a licensed addiction counselor. So I am not able to supervise the social work students. I'm just a lowly LMFT and a LAC. And so I have a team lead who our team lead, Natalie Quinones, is also, she's an LCSW and a LAC. So she supervises all of our social work students. And so we meet with all of our students weekly. So you're getting ongoing support, talking about what you're learning and seeing in your site and getting support in professionally what is professionally what's happening. And then also because of this work, the nature of this work, what might also be coming up for you on a personal level. It's not providing ongoing therapy, it's more just support and skill development. So there are also a number of trainings that we offer. So all of the trainings that are available to employees, we also offer to our students as well, aside from those where you need to hold a degree to get the training. So for example, certification in EMDR or neurofeedback, you need to have your master's degree to get that. But all of the other trainings that we offer to employees, we also offer to our interns. So great benefit there. Let's see, what else? Some other benefits are that you get exposed to a lot of different services. You see a lot of different types of folks. We also are a safety net provider, so you get that experience. Safety net provider being that we serve all people regardless of their ability to pay. So our primary contract is with Medicaid. So we serve all of the Medicaid needs in Larimer County for behavioral health. And also we serve anyone who may not have insurance or be underinsured. And so we serve them regardless of their ability to pay. So also just gaining that experience of working with all people. We also offer some, well, more and more universities, it seems, or programs are allowing employment-based internships, which is really exciting because doing unpaid work is a very privileged experience. And so we certainly support that. We also have some scholarship opportunities, which I'll speak about. And then also a benefit to interning at SummitStone is that you get priority consideration for positions, because ultimately that's a win-win for everyone. If you intern at SummitStone, fall in love with the work, or recognize, you know, this is something that I would like to do. Maybe I want to work on a different team. It's a benefit. So, okay. So scholarship options that we have in the last few years, we have received, funding for these scholarships where we are providing scholarships somewhere in the range of $2,000 to $5,000 per student per semester. So you get some kind of reimbursement for the work you do, recognizing, like I said, that doing unpaid work is a very privileged experience. And so these scholarships very much so fall in alignment with really walking the walk of DEIJ work. And so we award these scholarships. Priority population is folks who hold diverse identities themselves. And that could include anything from being raised in foster care, first generation, person of color, part of the LGBTQ+ community. And so that's that priority population, because we are really wanting to walk that walk of creating more inclusion, diversity, and equity in our system. So let's see, what else do I need to say about that? So in order for folks that are interested in that option, so it's just like a traditional internship. If you are interested, we ask all of the folks that are applying to complete some essay questions just about their background and also why they're interested in this option. So when you apply, we'll send those to you. And then you interview for that. And in addition to all the other benefits that you get with a traditional or unpaid internship, you get an extra hour of training each week to support you in your skill development. Okay, so in terms of the sites that we have, just watching the time, okay. In terms of the sites that we have that are a good fit for our undergrad students, we have somewhere around 40 to 50 different clinical programs at SummitStone, and Some of them are better fits for undergrad students. So one of our sites includes our crisis services. You may have heard about this. It's located off of Riverside, just north of PVH. And so our crisis services include a crisis stabilization unit where people can stay for generally up to 5 days in some kind of self-defined crisis to stabilize, whether that is related to substance use disorder, mental health, or anything under the sun. It's self-defined. Attached in this little unassuming building you would never know was there and all the things that happen there. So we have the stabilization unit, and then we also have the walk-in clinic. So anyone in the community can come in regardless of their ability to pay, insurance, documentation status, again, in some kind of self-defined crisis. So just like you might go to urgent care, right? If you sprained your ankle or if you'd had a fever for, I don't know, 4 days, we have a behavioral health urgent care. So in whatever kind of crisis you're in, to get support, safety planning, sometimes from there, it's decided that the best and safest option for you is to go inpatient for a while, to get stable, to kind of hit pause, get some more support, maybe get support with medications. So both of those services occur in that building. And also a new exciting service we've been offering it for the last year is rapid access to MAT services. So MAT being medication assisted treatment. So for folks that are looking to make changes in their substance use and are looking for some support to help with cravings and withdrawals, anyone can come in during the week. I think it's generally our MAT services are 8 to 4 and say, hey, I heard that there might be this med that I can take that might help me stop using alcohol. Can you help me with that? And they can come in and get it right away, which is huge for substance use disorder treatment, substance disorder options. We need to have them readily available to folks. All right, so that's crisis services. Garcia House, a newer program, opened about 3 years ago. So this is a longer term. So crisis services is more short term in nature, usually, like I said, around 5 days. Garcia House is 30 to 45 day inpatient circle programs. So circle programs are for co-occurring substance use disorders and mental health. And so it's longer where folks are staying, really rehabilitative in nature, where they are in a home-like setting, participating in cooking, laundry, and other skill building, while also getting treatment for those co-occurring needs that they have. So some of our services that we provide there are group therapy, individual, opportunities for family therapy and supporting the family system. There's also a gym there. Everyday clients usually go, as long as weather's permitting, we'll go. We're really close to PVH also, and we'll go and take walks over on the track there. So just longer term. So whereas crisis is more short term in nature, this is a little bit longer term. ACT, CDDT, and ICM, all the acronyms. So these are under our community-based services. So this is where we are meeting folks in the community and serving them. ACT stands for Assertive Community Treatment. CDDT is Community Dual Disorder Treatment. And ICM is Intensive Case Management. And so these are services specifically for folks who experience SPMI. Gosh, all these acronyms, I can't laugh. It's hard for me to keep a straight face saying all of them. Severe, persistent, and mental illness. I'm really not trying to confuse anyone. It's just part of the field. So these are people, SPMI is really for folks who have things like schizophrenia, severe bipolar, severe PTSD. And if these services didn't exist, the sad reality is that these clients would spend a lot of time in the emergency rooms and sadly jails. Because of unmanaged or poorly managed, just high acuity needs. And so it's a multidisciplinary team. Much of the work that we do at SummitStone is very teamwork and multidisciplinary in nature and collaborative. These teams in particular, though, are very integrative. So every morning at 8 a.m., the whole team, doctors, nurse, case manager, therapist, peer specialist, they sit down, they share a caseload of about 30 clients together, the whole team. So it's not just like, okay, you only serve these clients and this person, you all serve them together. So talking about what's going on with this client versus this client? How can we support them? Does someone need to drop off meds today? Does someone need to check in with this person? Does someone need to bring them to an appointment? So very dynamic and collaborative work in the community. So we do have a brick and mortar location, but oftentimes we're seeing these clients in their homes or wherever they might also be receiving services elsewhere, just to make it easy, because for folks who have this level of behavioral health need, it's really hard just even getting out the door, and sometimes even remembering when you have an appointment. So offering services to them in a brick and mortar location where they have to physically go and show up, just kind of, it sets them up for failure. And so we have this program designed to really come to them to set them up for success. Spirit Crossing Clubhouse. So this is a good option for someone who maybe knows that they want to work with people, but not necessarily in a clinical capacity. So it's a recovery work-oriented day program for adults. So interns will engage members in all aspects of the work order day. So wellness groups, basic case management, community support, goal planning, supported education. Also, this includes providing transportation. So this is a place where if folks, maybe they've been maybe they've been isolated or been out of the workplace for a while, are wanting to develop connections again and develop skills, where they are coming in and in a supported place and developing that skill set again, practicing social skills as well as developing work skills. And so this program is Monday through Friday. Whereas Garcia House and Crisis Services are 24/7 programming, ACT, CDT, and ICM are Monday through Friday. I think I need to be quick.
You're good. Okay, take your time.
All right. Another option that we have for undergrads is our family support program. So this is a good fit for someone who really likes working or is wanting to work with kids, adolescents, and their families. So these services provide individual and group community-based services to high-risk youth in outpatient or school-based programs. So during this placement, you would interact with kids in the afternoon and weekend hours, right? Kids are in school, so just something to be aware of if you're thinking you would like to work with kids and families. Generally, those hours are after school, evenings, and weekends, right, when they're not in school. So this is an opportunity to provide some lower level intervention skills with children and youth, including active listening, conflict resolution, and escalation. Our intensive care coordinator team is a program designed to be kind of a stopgap between folks who have maybe have gone inpatient recently and then need to engage with outpatient or ongoing services. So this team really coordinates between the hospital or the setting wherever the person is hospitalized to make sure that there's some good linking of services. And it's not just like, okay, you're done with being here at the hospital, on your own, go find services, right? And so it's a warm handoff and a wraparound of support where they provide interim services to folks as they are getting engaged with ongoing providers, also making lots of kind of outreach and follow-up calls, coordinating appointments to ensure that they have all of the support needed really to set them up for success, right? Because ideally, that's what we want, people to be connected with the services they need. And so it's not a frequent where folks repeatedly are going back to inpatient and feeling like they're not getting what they need. Okay. Something to keep in mind for this site is it's fully remote. So be aware of that, and that can be a challenge at times. Okay, so in terms of our application, interview, and matching process, so generally we open our application, and you can find that on our website, SummitStoneHealth.org. We generally open that in March for fall placements and around September for spring placements. We do consider some summer placements if that works better for you. And if that is something you're interested in, best time to apply is probably in March. We're still getting our ducks in a row in terms of funding and placement sites for fall. So we haven't yet opened applications. So if you're looking for a fall site, good news is there's still time, and I anticipate that'll open in the next few weeks. So what that looks like is you apply on our website, then our learning coordinator will reach out to clarify, hey, are you looking for a scholarship option, employment-based internship, or traditional internship, or like, are you open to it all? And then send whatever kind of materials are needed. Like for the scholarship option, they'll send you the scholarship questions. Then once you'll have the interview with me, and my job is to be kind of the matchmaker between our students and all of our sites. So really getting to know you in that interview to learn about what your interests, strengths, past experience, and goals are, to best kind of align you with sites that align with what you're looking for. Let's see, then there's the piece of kind of completing all the needed paperwork and background information. Once that's clear, then there's an orientation, and then you begin your placement. And so at the end of the placement, also, we ask all of our interns to complete a survey telling us about their experience, so we can really improve our processes and best support students. This is just some information that we've gotten from folks about their experience at SummitStone. So just an example of some questions that we have on our survey that we give students. I'll just give you a minute to look at some of the feedback we've gotten about interning at SummitStone. Yeah, and so our program goals really for internship and scholarship options are to provide students with real life experience, training, and certification options, create greater diversity, equity, and inclusion within our system, use our student feedback to grow and improve our program, and hire students who are passionate about doing the work we do as a safety net provider. We could kick it over to you. I think maybe we'll do questions once we're both through. Good.
All right. I'm just, is it okay if I jump over here a second?
Yeah.
Where would you find them? I'm pressing them.
It's this one right there.
Okay, I'll do that. Hi, everybody. I'm Adriann. I'm a social worker at Village Medical, which is Associates in Family Medicine. So if you're familiar with the community, just got bought out. So now we're Associates in Family Medicine and Village Medical. I'm a social worker there. Out of the 9 clinics, we have a social worker at every clinic. And then we have a few social workers that actually go out to senior facilities in the community where our patients are placed. So my little spiel here today is going to be about kind of my background, the sort of winding road of the way that I came into a career in behavioral health, as well as some opportunities that if I were in your shoes, possibly, I would have been seeking out to gain a little bit of hands-on experience in this field. Okay. So I wrote on here one path to a career in behavioral health, because one story is just that, just one story. And mine is that I got my undergrad degree in advertising. At that point, I just wanted to finish my undergrad degree. I think I knew I wanted to be in a helping profession, but I didn't know what. I randomly came into an internship in a nonprofit law office. I spent some time there. I really enjoyed the work, and that eventually led me into working in the court systems in Utah. I worked in the juvenile court system. And while I was there, I got to learn a lot about the different ways that social workers function within our communities, right? As mental health providers, with CPS, sometimes within the probation system. And at that point, I really thought, I think this is the field that I'm going for. I then actually moved here and I started working at CSU. I ran a small business partnership program. So I worked with professionals at all different levels within the university, got a lot of exposure there, and was fortunate enough to take some free classes here. You know, that was a great benefit of being a full-time employee here. So I was able to dabble in a few different areas, and ultimately decide to leave and go back to school full-time, grad school for social work. A little scary, but I did it. And for me, the benefit of getting that experience ahead of time, I knew going into grad school that I was going to make my internships work for me. So I know in a lot of the undergrad opportunities, you have internships as part of your programs as well. So I really encourage you to make that work for you and what you want to get out of it. If anybody was in the group here before, I heard them stressing that as well. I knew I wanted to do a medical social work internship. So for my first internship, I actually did the complete opposite. I went into the school system because I wanted to just gain a different experience. And I had a really great time there. So gave me a lot of different skills and tools to carry into the next phase of my work. I started working for Village Medical right after I finished my internship with them. So I've been there for almost 2 years. So before I give you some actually concrete, solid things in the community, I just wanted to talk a little bit about the opportunities that we kind of are already experiencing day to day. Like Emily was saying, not everybody has the privilege to be able to do a non-paid internship, right? Where you're spending 20 hours a week there. You're also trying to do your schoolwork. How are you going to pay your rent? So considering the tools that you're already learning, people in the service industry, like exceptional skills in de-escalation, right? Validating experiences, empathetic listening. Maybe that's not the first thing that you think of when you think about serving tables, but that is a huge part of that job. And it's an important part of it. So the things that you're already experiencing, that you're already engaged with, and then also finding gaps in places that you learn and work, like what is missing for the mental health support of the students around you? What's missing for those in the workplaces that you're at? I worked with an individual who managed a restaurant in Loveland, and I was working with him on something else, but then he also came to me and said, look, we had this situation come up where we had an individual come in. We found out later he's neurodivergent. He shared with us that he's on the spectrum, and he had a really poor interaction with one of our servers who the communication was really not great. Like, what can we do? Is there a tip sheet? How can I train my staff to feel comfortable with these interactions? Because in customer service, you never know who's walking in the door. You never know what story they're going to bring, right? And so those kind of things, right? In all these different job roles, you're working with humans that have different relationships, that something happened to them right before they walked in the door. So expanding kind of our thought process a little bit on behavioral health, not having to specifically be in a mental health setting. Let's see, what else do I have on here? And then also lived experience. So if you're a person that has lived experience with a mental health condition, with substance use disorder, there are opportunities to provide peer support, mentoring, and guidance within multiple different organizations in our community. There's national organizations that do virtual groups. Or not only if that lived experience is your own, but if you're the family member of somebody that has struggled with those things. There's a National Alliance of Mental Health, NAMI, it's an I, not an H. Anyway, so they're a big national group. They have a local chapter here too, and they do a lot of peer support type stuff. So if you have that lived experience, that would definitely be something to consider. Okay, so actual concrete options. I kind of compiled a list of some groups that I partner with in my work. And then also some things that I've just learned of through work recently that I think might be a good opportunity for somebody that's not working in grad school right now, that's in their undergrad career. Dementia Together is a nonprofit out of Windsor. They work with people that have been diagnosed with dementia and their care partners and loved ones, support groups, education. There's a woman named Cindy that runs it. She's a retired nurse. She's amazing. And she really provides a lot of hope in a situation that can be really scary for a lot of people and a lot of families. So they may be willing to take on an intern or just job shadow. I'll talk to you a little more about that. So if you think maybe this is a population I might be interested in working with, reach out to Robin, shoot her an email, tell her what you might be interested about, and see if you can set something up. Alzheimer's Association, similarly, they work with in Northern Colorado, Angels, the director of the chapter up here. And they do a lot of advocacy and education work. They also do a lot of fundraising for research around Alzheimer's. So if you think you might be interested in like the administrative side of mental health, you can reach out to Angel and see if you can do any kind of shadowing or interning with her. UC Health. So like I said, I knew I wanted to go into medical social work. I knew I wanted to try that out. In my very long career path getting here, right? I actually shadowed through UC Health in a facility out of state, speech therapy, physical therapy, OT, and social work. So, you know, it was 10 years from undergrad to graduate degree for me. So I was really trying things on, and it felt really helpful for me to go and see what it looked like for somebody to do a job every day. So UC Health does allow shadowing and observing. So you can just Google UC Health shadowing. They will list out the specifics that you need to do. Really, it's like making sure you have your TB test done. And I actually didn't have a person that I knew I wanted to shadow. So I just reached out to UC Health and said, hey, I would like to shadow a speech therapist for 4 or 6 hours. Would you be able to arrange that for me? Here's why I'm interested, right? They kind of want to know your background. It doesn't have to be that you have all this experience, but like, why are we going to put the time in here? They're hoping, like you've heard from other people today, that they're going to get back, right? We want you to stay in this field. We want you to come work for us at some time. Crossroads Safe House, which is an emergency shelter for victims of domestic abuse and their kids. Right now they are hiring a part-time youth and family advocate. That's hourly, part-time, does not require a degree. So it looked like when I read about it and heard about it through a friend that hours could be flexible and negotiable. So there's some way to get some experience with some money if you're interested in working with folks that have experienced domestic abuse. These top 2, Pikes Peak Respite Services and Lutheran Family Services. If you're interested in working with kids and families, those are both part-time hourly paid positions that appear to have flexible hours, that you do not need to have a great degree to work in. And I'll also stress that with any of these, you don't have to know for sure you want to work with seniors or geriatrics, or I definitely want to work with kids and adults, right? In any setting you're in, you're working with humans, and we all have relationships between each other. And that is kind of the essence of behavioral health, is understanding people, you know, and you'll get exposure to that in all of these places. Columbine, here we go. So right now they're hiring an activities assistant and a food and nutrition aide. Again, don't need a degree, hourly work. And you might think, okay, as a food and nutrition aide, what does this have to do with behavioral health? But like I said, you're getting exposed to those people. You're going to see those people every day. You'll build relationships with them. You might get to know their family or loved ones that are coming in to visit them. And it's a great way to get exposed to an environment and say, is this my population that I want to work with? And then Foothills Gateway. Foothills Gateway, if you're not familiar, works with individuals with developmental disabilities, intellectual disabilities, and their families. And they're hiring a direct support professional, flexible hours, don't need a degree, good exposure. I also actually had a coworker send me a message this morning about one more. So figure your notepads, sorry. Integrated Wellness is a private counseling group here in town. They're hiring an administrative assistant for 5 to 10 hours per week, $20 to $25 an hour. It's remote, but you're going to be talking to the folks that are looking for therapy, right? You're going to be talking to the folks that are looking to get rescheduled with their therapist. And I would even say, not that the therapist can then divulge what they worked on with that person, but you could certainly talk to the therapist in that group saying, hey, I was on the phone with this person, they asked about this. What would you do to approach that? Like, where do you go with this person next, right? To give you some background and just thought process through how individual therapists work with their clients. This is the last one, the last slide. So just questions for now for both Emily and I. So all the SummitStone stuff or anything. And I will mention too, we with Associates in Family Medicine, I can do shadowing. So if you want to come shadow me, we had a master's intern, we traditionally have, and we will get back to that. We're just not doing one right now. So if at some point you go to grad school and you're interested in primary care, which is what I do, not in the hospital as I work in primary care, let me know. I'd be happy to chat. Good question.
I'll ask a question. What other, besides an internship, you mentioned work and job shadowing. I mean, how else can students just find out what's going on? How do I, I want to help people. What do I do with it? Just exploring other options.
I think setting up, if you have some kind of contact, or if you're looking for a contact, informational interviews are also helpful. So I know oftentimes for certain classes, you're required to do that. And I think it's one of those assignments that's really helpful. And so oftentimes if you are required, your professor might have a list of folks that you could go to. If you're wondering though, you could always ask a professor yourself, or your academic counselor as well. Like, hey, I'm wanting to learn some more about this. Could I interview someone who's doing this work or has been in the field? I think that's another great way that you can just learn some more.
Yeah, and to not be fearful to reach out. Sure, cold calling and cold emails, like it's kind of tough, and you're thinking, maybe there's nobody will respond to me, but maybe they will, right? If you send out 5, you might get 1 back. It's worth putting it out there. And I also feel like professionals in the helping profession are stoked, right? They're like, yes, let me tell you all about this thing that I'm passionate about, and I want you to be passionate about too. Or to discover, I want nothing to do with what you're doing. That's okay too, right? It's all exploratory and it's learning. And it's better to figure those things out now too, right? So if you try on multiple hats now, later on, it'll help you kind of narrow up what you do want to focus on.
What are some of the best questions for students to ask when they're talking with internship facilities about opportunities in those facilities, hours that are available for their internships, or ability to rotate between programs?
I think just that. I think you answered the question. Yeah, I think just being transparent about what your needs are and interests. And saying, like, can you tell me what options there are for someone who is maybe a non-traditional student, or also needs to be working, or caring for a family member, or what do you advise? I'm kind of open to anything. So I think asking them what their options are, and it's also helpful to share what your needs are as well. And certainly I think more and more, and especially at SummitStone, I think there's more and more flexibility, knowing that especially for students, you've got a lot of other demands in your life, and no one expects you to just prioritize this one thing. And so I think sharing what those are could be really helpful. So then we can figure out what options might be the best fit, right? Like, for example, I know sometimes a better fit for folks who might be working or caring for a family member. Sometimes our 24/7 services are a better option. Not that we have interns overnight, because hopefully folks are sleeping then, and we want you seeing things that are happening. But afternoon and evening hours or weekend hours is helpful, right?
Yeah, and I think definitely the transparency thing in any internship that we've had, including when I interned there, people are very flexible, more than you would think so, right? Because this is your time, and this is your time to learn, and you have other priorities too. This isn't the only one. And sometimes bigger priorities in school, like you're trying to do a thing to get to a career. Great. There's life stuff that happens in between those things. So we have had people be in clinic sometimes, and then independently working on a project sometimes on their own hours when it works for them, right? And it still goes towards their internship hours. They'll call out sick people, have family things that come up. Like, this stuff happens, and as long as you can tell, the people that are interviewing with, share with them what you need, they're going to be able to meet that need a lot better than when you're halfway through your internship and finding out that the schedule is not really working for you. But yeah, I think you structured it right then. And remember, like, you're in the driver's seat, right? Like, this is for you, and like, we're here to guide and help out.
What advice would you give someone that takes an internship and in the middle of it, they just find out it's completely not for them?
You're not alone. It happens so much. It happens so much during my program. I think within the first 3 weeks of my second internship, like 7 of them had switched, which I think is abnormal. I don't think it happens all the time. But that's okay. You can't know until you're in it. And it's experience that's for you. You're paying for too, right? Yeah, this is something that you're doing. That's okay. And the best thing you can do is speak up as early as you figure that out, you know? I don't think there's any hard feelings there, right? And the school is set up to be able to help you transition, right? They have people in place that if that happens, they're the ones that help you realign everything else.
Yep, I think letting someone know, and also knowing, yeah, that's part of the point of internship or practicum is to figure it out. And I think knowing what you don't like is a great start, right? If you know this absolutely isn't for me, hey, that's really helpful. And so absolutely communicating that with your advisor or your support in that placement, and then also the site as well. And they might be able to navigate too around how can we switch this up and make this a better experience for you? What about this isn't working, right? That's what I do with our students whenever we've had students that say, oh my gosh, like this is not at all what I thought or was looking for. Then let's put our heads together and look at the table and find some solutions to make this the experience or a better experience, or what you can get. Let's talk about what you can get out of this and support you through it too.
Yeah, you may be able to pivot within the site that you're already at, or there's, for a lot of the internships, there's the field supervisor. I think that's actually on site there, right? And then you have a field instructor. It's usually not the university faculty or anything like that, but they work at an outside agency. So they're kind of like a third party. That person is really great support for that. Because then they can help you talk through it, even if you want to talk through it with that person before you talk to your site. Like, look, this isn't working great. What are some other options we can look at? Good question.
If I can add one other piece of information, so there's lots of direction going towards work-based learning, which includes internships, but also apprenticeships. So those are opportunities that are coming down the pipe. It's a very big, not only across the country, but also in the state as well. So lots of money coming in. So educational institutions are and industry partners are getting some of those monies as well. So those are other opportunities where you can get paid doing a job, but also getting experience while you're there. So those are other things to look for and ask about. Well, I know SummitStone has, I think, one of our first. Is that right, Chris?
Yeah, medical system.
Yeah.
Yes. Yep. So more on the med. So I'm more on the like clinical, like social work, therapy, counseling side. But yes, we have some apprenticeships on the medical side of the house, which is really exciting. Like lots of steps in the right direction.
And I think we're working with some of the partners in Northern Colorado to explore more pathways and apprenticeships, so that they don't have that
Great.
pop off the income training that
Ah,
continue their education.
absolutely.
It is an exciting time to be in mental health for that fact, right? There's a lot of need.
Yes.
Scary and overwhelming some days. But there's more money coming towards it, which has been a very big issue for a very long time. Including the state, there's a new like state bill for primary care and mental health, and yeah, anyway. It's all happening, folks. Come join us.
All right, well, thank you to Adriann and Emily. So thanks everybody for being here. And I hope you enjoyed the session as much as I did. Learn more about both your agencies than before.